Hello everyone, you are all welcome to lecture number 1292 and today's topic is gangrene, causes, symptoms and treatment options. So here the word gangrene, let me make it clear. Gangrene has nothing to do with green color because many people used to have this impression. Even they say that if your any area becomes dark green and then dark yellowish or towards black color, then it is gangrene. No, gangrene is your condition, not color. And the word gangrene is Greek. In Greek, gangrene means muscle damage or tissue damage or dead. So once they have the muscular damage or tissue damage or muscles and tissues are dead because of many conditions, then they will call it, that condition is gangrene. So the gangrene is a condition where your tissue or muscles, when they are not getting enough blood, if there is no blood flow in that area, so your tissue and muscles, they start damaging and dying, and that condition will be demonstrated by change of the color. First slightly greenish, yellowish color, then dark brown color, dark color, and finally it is very dark black color. It means it is full blown and there is no recovery of that unless you call the surgeon and let them remove that portion. And there are different type of gangrene. One gangrene is called, that is dry gangrene. So dry gangrene means it is non-bacterial. You got damage of your tissue or muscles because of frostbite. If very cold, maybe temperature is minus 20 or 15 like in Toronto, Canada, New York, and you are exposed and sometimes your fingers, that area is dead and where capillaries cannot flow. I mean, will not allow the flow of blood to that area and you will get gangrene. That is called dry gangrene. And the wet gangrene. Wet gangrene means once you are getting such type of damage or tissue are getting dead because of bacterial infection. And the third one, that is called gaseous gangrene. Gas gangrene means when it has gone deep, the bacterial invasion, once it has invaded deep into muscles and where your skin is cracked and it gets some bubbling gas, cracking sound, broken skin, that condition is called gas gangrene. And third one is genital gangrene, means once you get some attack in your ureter or penis or in that area, that is the fourth type. So basically either it is bacterial attack or without bacteria, and it can happen to any part of your body. It can be finger gangrene, leg gangrene, feet gangrene, intestine gangrene, genital gangrene, wherever your tissue and muscles are damaged because they are not getting enough blood. So here, who are at risk factor? We have to see it. The first risk factor for those who are diabetic. Those who are diabetic means there is thickness of their blood, viscosity is more, sugar in the blood is more. So that's why capillaries are not in position to make blood flow up to the last point of your leg. So mostly those who are diabetic, they get feet gangrene, means where they are not receiving enough blood and slowly they start dying. And also in those people who are having excess weight, obesity, and where there is blood clot or some more cholesterol, because of that the arteries and veins of the blood, their capacity or spaces are less, so that blood is not reaching to the end point. And if it is chronic condition, there is no option except to go for surgery. But luckily now, if it is limited up to feet and finger, and you have attended the emergency quickly, because first you have to identify that whether it is gangrene or not, and if it is not responding to some cleaning or dressing and it is multiplying, you are having some mild fever or some pain and swelling. So all these cumulative factors, they are indicators that it is gangrene and better to consult your doctors. And here multiple doctors are required. Someone may be endocrinologist, that is diabetic specialist, somebody surgeon, somebody orthopedic surgeon, somebody for skin disease. So like that, so to exactly conclude whether it is gangrene or not, and if it is gangrene, which type, bacterial or non-bacterial, and immediately action should be taken, because if it is not attended very quickly, it may lead to amputation, either your arm, your hand, your finger, your half leg below the knee, and that is very dangerous condition. And so far I have gone through some statistical data and some of the patients' condition, and it is reported that those who have undergone half knee amputation, means below the knee, one leg or both legs are cut, their survival rate is less than lung cancer 4 stage. Some they survive only for maybe 1 year or 2 years, or some maximum may go up to 3-4 years. So it is better to take care in early stage, and I am showing some of the gangrene to you. So these are 4 images of fingers, and these images are the images of dry gangrene, and that dry gangrene is because of frostbite, means minus temperature. So first stage it will be having light color, reddish color, then second stage it will become more dark, and then third stage it will be dark, blackish color, and the fourth stage means terminal stage, chronic stage, and where it will be totally black and no solution except to cut them and put some bandage and do the angiography and angioplasty. This is the symptom of gangrene, and where there is swelling is also one of the indication, and front finger of the feet, they are all totally dead. That's why they are black in color, and it is because of wet, maybe bacterial attack, gangrene, and the only option is you have to remove all those dead muscles, tissues and cells, and latest do the angiography, angioplasty, so that capillaries are capable of pushing the blood to those areas where it is still in good shape. This is the chronic condition of gangrene where amputation is done means below the knee, almost half of your leg is amputated, because if it is not done, then that toxic, all those bacteria, bad smell and dead tissues, they will be spreading throughout the body within no time. So the only option is just to go for amputation, means to cut down that portion of the leg below the knee. But I have already told you that this condition is very serious condition, means the survival rate is we can say very low, maybe only 30-20%, 75 to 80%, they survive only for 1 or 2 years, or maximum 3 years. So in the form of summary, what I have told you is given with some addition, that how you can know what are the symptoms and sometimes your preventive measures. So here, number one, gangrene is a dangerous and potentially deadly health condition. There are mainly 4 types of gangrenes. I have already told you all this. Number one, that is called gangrene, dry gangrene, means it is due to the cut off flow, due to blood flow cut off in the area. Any area where blood is not reaching, it is cut off, you will get tissues damaged and dead. Number 2 is, that is called wet gangrene. It is bacterial invasion. And then third is gas gangrene, means where it is deep damage and injury. There will be bubbling of gas and cracking of skin, that is called gas gangrene. And the fourth one is Fournier gangrene. Fournier gangrene means where it is attacking, the bacterial attack is there to your genital organs like penis or urinary tract. That is called Fournier gangrene. Number 2, causes of gangrene. There are several causes. Number 1, inadequate supply of blood to particular area of body can cause gangrene. Then, and how will you understand that in your particular area the blood supply is not proper? Very frequently getting numbness, you feel cold in that area, weak in that area, it indicates that the blood capillaries, blood vessels are not supplying enough blood in that area, and that may be due to that narrowing of the blood vessels and maybe some clotting inside. That's why nowadays this after the advancement of technologies like angioplasty is doing miracle, so that immediately it is clear an area where it is ballooning is done, and once ballooning is done, angioplasty is done with angiography, it is located where the blockage is there or where it is narrow, then it is recovered. But once it is very late, once that portion is already damaged, no recovery, you have to cut that area. Then number 2 is diabetes, skin infection, injury. Those who are in diabetic condition, better they should be careful of their shoes. They should not move always barefoot, means without putting any good shoe. Also the shoe should not be very tight. There should not be shoe biting inside or injury. And if any minor injury is there, properly take care of dressing so that it should not go to deep bacterial infection. So that is very important. The reason is that in the case of diabetic condition, because of lot of sugar retained in the blood, the nerves as well as the blood capillaries, they are not in position to supply the blood, and blood flow will not be there that much. That's why in diabetic condition to get gangrene is very common. And then number 3 is frostbite, burn, and dog bite. If there is dog bite, there is frost bite, and also burn. You should not take it lightly. There should be proper dressing and treatment. Then number 4, bacterial infection such as Clostridium and perfringens. So Clostridium perfringens is a type of particular bacteria. When it is attacking, it is invading to your muscles and skin, it is gangrene. You will get gangrene. Number 3, symptoms of gangrene. So first is sharp pain in affected area. You will get swelling. You will change the color from yellow, reddish to dark color. So swelling and surgery and bad smell in that area, and finally fever. Number 4, treatment options. So treatment option first is, if it is wet or gas back gangrene, but antibiotics is the best option. Number 2, if it is already damaged, surgery, no any other option. And third is angiography, angioplasty. You are going for angiography. Angioplasty means if suppose this area is already dead, so they will remove this. So they will do the angioplasty up to this area, that blood will be coming, so that further it will not escalate to other portion. So that is the very big role or important role of angiography and angioplasty to treat the gangrene condition. So that is angioplasty. And then hyperbaric oxygen. Hyperbaric oxygen means you will be taken to chamber under pressure, lot of oxygen, high oxygen, pure oxygen is given to breath, and it can improve. That involves pure breathing of oxygen under pressure in chamber. Number 5, pain management. Pain management means the proper wound care and cleaning, washing, dressing, and if it is necessary, you consult your doctor, will be there to take some painkiller, anti-inflammatory or other ones. Then come to number 5, preventive measures. How will you prevent it? Maintaining good blood flow. That is the first prevention. At any cost, you keep in touch with your doctor and make sure that your bloods are reaching to your all end point. End point is especially to your feet, finger and hair. And if you get some numbness, coldness, some tingling, all these things, it means your nerve is affected, your blood supply, blood flow is affected. So in that condition, nowadays very, very good medications are there, and your doctors will advise you. So that is the first condition, that the preventive measure is to maintain your blood flow. For that, if medication is needed, you go for that and keep in touch. Consultation with doctor is very important. Then number 2 is that is practice good wound care. If you get at any moment, anywhere, any minor injury, don't ignore it. Do proper dressing, put antiseptic, antibacterial ointment, so that there should not be any chance of any bacterial growth. And then number 3 is that is early diagnosis, and also stop smoking. Smoking is linked to your blood vessels fragility, and it's a narrowing condition, that is because of nicotine. And then if you suspect any type of thinking that it may be gangrene, immediately rush to your doctor. So with this, I will stop. And in the last but not least, especially those who are having diabetic condition, sugar problem, sugar in the body, please be careful of any injury, even if you are having minor injury even during nail cutting, or even if you get any small injury, don't scratch and don't take it lightly. Do proper treatment. Once again, thank you very much for watching the lecture.